Hi class, I'm going to do my presentation on the C-spine. I put together a PowerPoint that I'm just going to go over my case study. So I'm just going to turn my camera towards my PowerPoint. Hopefully this can get in there. All right. So first of all, I'm going to go over some of the problems that this case study, this patient was having. First of all, I wanted to go over the disc herniation, what that is. I'm sure most of you have heard of them and know what they are, but basically I'm just going to explain what they are. And they're when the spinal disc soft jelly-like center of the nucleus is ruptured and it pushes through a tear on the outer enclosure of the disc and it pushes into the spinal cord. A lot of times depending on how big the bulge is, it can protrude out and affect the nerves going through the vertebral. Well, actually, it would be more through the transverse foramen, where the nerves come in through the or go through the vertebrae. Sometimes, if there's a disc herniation that's going more lateral, left or right, it can push on those nerve endings. Or it just pushes right through the vertebral foramen, which is where the spinal cord is going through, and I'll show you some examples of that. So a lot of times the symptoms include pain or numbness or weakness, and that's usually due to where the nerve is being pushed, because sometimes the nerve in the C-spine, if it's pushing on the nerve closer to the left, it'll feel more pain or numbness on that side of the arm, or even sometimes on the lumbar spine or thoracic spine as well. It can push on that nerve and actually cause pain in the leg. So when this happens, it's best to get medical attention. And the reasons for these disc ruptures or disc herniations are usually from age-related wear and tear. People can't always pinpoint exactly when they started having it or why or how they got it, unless they were in a bad accident, like a traumatic car accident that ruptured their disc in a blow to their back. But that's not as common. I mean, that can happen, but a lot of times we get it from just lifting heavy objects the wrong way or twisting wrong by using our back muscles rather than our leg muscles. And then as far as my case study, my patient was having neck pain in her neck, and she was feeling it down her left arm, the numbness, and it happened during a workout activity when she noticed it the worst, and it just tended to stay there and linger and not get any better. So that's when she went to her doctor, and they referred her to the Simon Med and they took 3 x-rays of the C-spine, which were the lateral C-spine, the AP axial, and the open mouth. And in the findings of the radiologist, they basically saw that there was straightening of the lorotic curve in the C-spine. It was straightened out, not have, and it wasn't curved the way it should be naturally. And there was no evidence of fracture or subluxation, but there was some mild spondylosis between C5 and C7, which I'll go over in the x-ray, but everything else was intact. So just to go an overview of what subluxation is, it's a partial dislocation or slight misalignment of the vertebrae. And then spondylosis is a painful condition where your discs are degenerating while the vertebrae is degenerating and flattening. And it can put pressure on those discs, which that's when you can get a herniated disc. So that is basically when there's flattening of the vertebrae from wear and tear. And so these are the 3 images. And my first image is the lateral C-spine. And basically I have in the arrows which show where the mild spondylosis is and the disc generation. The next x-ray shows a closer up of the same image. I was showing how these disc spaces are bigger, opened up more with no wear and tear of the vertebrae, is nice open intervertebral disc space. But right between C5 and C6, that is the finding of where they were finding some spondylosis, which shows some probably disc degeneration. And then also a little bit between C7 and T1 as well. And the next two views are just part of the C-spine series. I just pointed out some of the anatomy that we know now. This is the dens and the lateral masses, showing that. And then the other C-spine was the apiaxial. And I just pointed out as well that between C5 and C6, where she saw the narrowing between the intervertebral disc space, you can't really see that as well on this view, but you can see that the spinous process of C6 is not quite in alignment. It's not centered to the rest of the C-spine. So that's probably where she saw the subflexation of the spine. So it's not centered. So there's like a little bit of a misalignment going on right there. So now naturally, these x-rays didn't show where the herniated disc is. Usually that's not where you see they're diagnosed as much. It's usually on an MRI. And I just wanted to show a view here of my MRI here of the patient. And this is definitely going to show where the herniated discs are. First of all, the findings were the normal lorotic curvature was straightened out. And as you can see right here, this is the spinal cord, and between where the white spot is, right in between there, that is the spinal fluid. And that's protecting the spinal cord. And this is supposed to be a pretty good space of white going on right there, like on this side. But as you can see, between C3, C1, C2 up there is good. C2, C3 is good. There's not much, maybe just a little there, but not much. It's still white. Where you're seeing it is C4 and C5. It really protrudes out where you kind of see it's pushing. So the findings were that it's kind of flattening the spinal cord and possibly pushing on one of the nerves on the left side of the intervertebral foramina, where the nerves go in and out of the vertebrae. That rupture is pushing probably on one of those. That's where the pain on the left side of the arm is happening for the patient. And C5 and C6, there's a little slight bulge right there as well. So basically that's where the mild disc bulge is. This one's a little more severe of a protrusion, where it said that there was some flattening and stenosis going on. And let's see the next slide. I just wanted to kind of go over what stenosis is. It's basically a narrowing of spaces within your spine, which was when you put pressure, there's pressure on the nerves that travel through the spine, which was going on with the ruptured disc. And the foraminal stenosis is tightening of the openings between the bones of the spine. I don't know if I pointed that out, but you can kind of see that there's probably some space closing in there because it doesn't look quite as open between those two as it does here and here and here. So there is slight flattening or closure where it says there's foraminal stenosis. And real quick, I just want to go over just a live view of the MRI. Okay, now here's an axial view of one of the C-spines. It's taking axial views of each section of the C-spine. And I just want to point out a little bit about the anatomy. This is where the patient's back is lying down. It's coming in an axial view. And right there is supposed to be the spinal cord, the windpipe, and then there's the vertebrae right there. There's the vertebral foramina, and then yeah. So basically, this is probably one of the C-spines that did not show any kind of bulging. So the next view is pretty good too. It doesn't have any. And right here is where I'm thinking this is where they are showing the bulge a little more, because you can still see that there's a good space between the spinal cord and the vertebrae right there. But right in here, it seems a little more closed, and it's towards the left side. And I believe that's where the herniated disc is kind of pushing into that part of the nerves in the intervertebral foramina space. And it's going to be protruding a little more in the spinal cord as well. And some of the treatment options for herniated disc, I'm going over a few. I'm sure there's other options, but there's physical therapy, which would involve the patient going to see a physical therapist that will give them exercises to manage their disc pain and probably do strengthening exercises. And if that doesn't work and they give it like 6 weeks, a lot of times they go and do surgery on the disc, which means they'll remove the protruding portion of the disc that's pushing into the spine or the nerve that's causing the pain or discomfort. But in this case study, it worked to do the physical therapy and the chiropractic route. So actually, this was me. This case study is about me as a patient, and I had this probably about 6 years ago. I went in and got an MRI and found out that my pain was coming from a herniated disc, and I was able to manage my pain with the treatment option of therapy. So, and that's all I have. Hope y'all enjoyed. Thanks. Bye.